To enjoy the good life is to have the best possible health care and services available when you need it. So, whether you walk through the hospital for elective care and services or you're transported by ambulance for emergency, you need to know that your choice of hospitals is the right choice. And that takes us to West Jefferson Medical Center in Marrero, Louisiana. My first stop is the Sleep Disorder Center, and if you're one of 70 million Americans that didn't get a good night's sleep, you've come to the right place. Let's go inside. The manager of the Sleep Center is Julius Waddell, and he's going to take us through and show us how people are tested and diagnosed for sleep disorders. Julius, there's an amazing statistic that 84 million Americans have some form of sleep disorders.
That's correct, Mary. The most common, though, that we see here is obstructive sleep apnea, periodic leg movement, and restless leg syndrome.
Well, why don't you take us on a quick tour and show us around?
Okay.
And right here we're applying the EEG electrodes, and those are used to see whether the patient is awake or asleep. We use about 20 wires. We're going to be monitoring your heart. We're going to have some belts around you. We're going to have some wires around on your legs. Hooking the electrodes up to the main head box, which is therefore connected to a cable which goes to the computer system. It acquires the data, and then so that the technologists inside of the control room can view the data. We'll record a minimum of 6.5 hours. Yes, I'm here with Mr. Edward Lasang. He's going to share his experiences here at the Sleep Center with you.
I've been suffering with sleep apnea for about 20 years, and I stopped breathing during the night. And when I came here, the machine and the experience I had here was very good. And I would recommend this for people that has this problem to come in and let them have the test done, and they'll sleep very good.
Julius, what are some of the most prevalent disorders that you diagnose here at the center?
The most common is obstructive sleep apnea, followed shortly by restless leg syndrome and periodic leg movement.
It's amazing, but 18 million people suffer from sleep apnea.
Well, obstructive sleep apnea, basically what happens is the airway occludes when you get into the deeper stages of sleep. You're still making an effort to breathe, however, you're not moving any air. The oxygen level then begins to fall in your bloodstream, and it stimulates your brain. Patients will typically wake up with a loud snort or gasping.
Very serious problem.
Yes, it is. It affects a lot of Americans.
Well, you know, Mr. Lasang had a wonderful testimony, and I sure hope that will encourage people to come to the center and be diagnosed. I want to thank you for your time and for your information. And now I'm headed to the radiation center where we can check on that state-of-the-art cutting technology cancer treatment called CyberKnife. We've seen rapid advancements in the technology to treat cancer, and West Jefferson Medical Center is only one of 2 centers in the entire state of Louisiana that offers this technology, and it's called CyberKnife. Kelly Swatter is a radiation therapist, and we're going to join her so she can show you what CyberKnife is all about and how it works and how it treats cancer.
Thank you, Mary. I'm here today to talk about the CyberKnife. Basically what it is, a linear accelerator sitting on top of a KUKA robot. This robot allows us to treat in over 1,200 different positions. We can get to any tumor just about anywhere in the body. It's non-invasive. We don't have to use any needles for anything. It's pain-free. It doesn't hurt. You don't feel it. The machine and the X-ray system that it has allows us to take an image, match it up to a CT and MRI that we've done before treatment. Therefore, we get the same treatment every day, every time in the same position. We can treat tumors that have already been pre-treated. We can treat tumors that are benign as well as malignant. The CyberKnife is wonderful because it can allow you to get treatments in 1 to 5 days as opposed to 4 to 6 weeks. So we can have a prostate patient come in and we can treat him in 5 days, whereas in conventional radiation, you treat them for 4 to 6 weeks. So you virtually cut the treatment down by 1/4. One of our patients is here today, Jim Daigle, and he was treated for prostate cancer. He was recently told that he is cancer-free. I know he'd like to share his story with you.
Hello, I'm Jim Daigle. I'm here to talk about my experiences with CyberKnife through my yearly exams and treatments. I was found to have prostate cancer. I was referred here to see Dr. Clay Gould, and upon arriving here and talking to him about it, I made the decision out of several choices of treatments for prostate cancer was to go with the CyberKnife. I'm happy to say that 3 months after CyberKnife that I am cancer-free, 100%. The experience here was great. The staff here was just unbelievable, made me feel very comfortable, and that was one of the big points of the CyberKnife after meeting them. Dr. Gould's very, very adamant about the procedure, and he actually sold me on the procedure. I'd recommend it to any and everybody.
Thank you, Kelly, for giving us a comprehensive look into the latest treatments for cancer. West Jefferson Medical Center provides the highest quality in health care, and they'll always be there for you when health matters. Well, it looks like we've come to the end of our show. I sure hope you enjoyed it, and I hope you'll come down and enjoy all New Orleans has to offer, because it's the city that never sleeps and the party that never ends. So hope to see you right here next time on Real New Orleans. Until then, make it a great day, and always remember, keep smiling, everybody. Bye-bye.
Yeah, they got crabs, crawfish, catfish, and gumbo.
Gumbo.
Oh, yeah.
You know how we love our crawfish, though. We love them hard, hard, hard. We swear to God. I know, baby.
Hey, me, I like crawfish pie and, you know, some stuffed artichoke.
I love that. Lots of garlic. Oh, that's good.
Hey, you know, how you get to buy this, Bubba's? Bubba's is, oh, hell, I think it unclosed after Katrina. Oh, Katrina. I hate that word. I hate about that.
You know, y'all people are a piece of work. Me, I love stuffed artichokes and raw oysters. Ooh, that's good. Well, let's eat up, y'all.
Yeah, come on. Let's eat up, Claire. Stop that hollering now. Yeah. Hollering? Who's hollering?
I heard you hollering. Welcome back, Casey Queen.
Thank you. Well, now I know how it's done, and now I'm getting ready to do it. What do y'all think about this crawfish ball?
This is real New Orleans.